In this final section, we'll discuss anxiety and depression screening tools. There are a number of mental health screening tools that assess anxiety. Some screen for only one type, such as generalized anxiety, and others screen for multiple types of anxiety disorders simultaneously. We'll discuss these tools just briefly for the purposes of this training. The United States Preventive Services Task Force recommends screening youth age 8 to 18-year-olds and young adults for anxiety. Similarly, the American Academy of Pediatrics and Bright Futures recommends annual screening for behavioral, social, and emotional problems, including anxiety in children and adolescents for all those under 21. There are different types of anxiety disorders, such as generalized anxiety, separation anxiety, social anxiety, along with specific phobias. On the next slide, we offer a brief summary of screening tools available for anxiety. Again, the USPSTF recommends screening adolescents 12 to 18 for depression in practices equipped to provide either a diagnosis, psychotherapy, follow-up, or referral for these services. So as part of your implementation, I would suggest identifying who you can refer to and to think broadly about who that referral person or personnel may be, such as this could be simply someone's pediatrician, and whether that's through the health department or in a private practice. This section reviews one of the most commonly used depression screen tools, the PHQ-9, and this one has been adapted for adolescents. Severity measures for generalized anxiety disorder for children aged 11 to 17. The American Psychiatric Association's severity measure for generalized anxiety is a 10-item self-administered tool to assess the severity of generalized anxiety disorders in children and adolescents over the past week. It can be used to track changes in severity over time. There's also a screen, There's also a screen for child anxiety related disorders called SCARED. The SCARED is a 41-item self-administered tool used with adolescents aged 9 to 18 and their parents to screen for anxiety disorders, including generalized anxiety disorder, separation anxiety disorder, panic disorder, social phobia, and potentially even school phobias. The Patient Health Questionnaire 9 is brief, reliable, validated screening tool for depression. Specifically, it is the depression module of the larger Patient Health Questionnaire, which is a self-administered version of a primary care evaluation of mental disorders patient health questionnaire, which is called the PRIME MDPHQ. Although first developed in 1999 for adults, research on the PHQ-9 has since demonstrated its applicability to adolescents with an 89.5% sensitivity and 77.5% specificity for mood disorders, which is quite good. The APA's severity measures for depression for children age 11 to 17, also referred to as a modified PHQ-9 for adolescents, is used to assess risk for depression. It's been used for both adolescents and young adults. And suicide is the second leading cause of death among adolescents and young adults aged 10 to 34. Substance use is the second most common risk factor for suicide, with alcohol and drug use increasing risk 10 and 14-fold respectively. As such, it's critical to screen for suicide risk in addition to alcohol and other drug misuse. The Ask Suicide Screening Questions, ASQ, is a 4-item screening tool to assess suicide risk with adolescents and young adults aged 10 to 24. It was designed for use in emergency departments, inpatient units, and primary care. It can also be used in other settings such as school nursing office and juvenile detention centers. It takes less than 1 minute to administer and is available in multiple language. The ASQ Toolkit is available from the National Institute of Mental Health, and we've provided the link here so that you can access that toolkit. It's an excellent option. The Columbia Suicide Severity Rating Scale is commonly referred to as the CSSRS, or the Columbia Screen, is a 6-item screening tool to assess adolescents and young adults aged 12 and older for suicide risk. It was originally developed to assess risk among adolescents with depression. The CSRS is routinely used in research studies for children 6 years and older, and the children's CSRS version is intended for children 5 years and younger. The tool assesses for the full range of ideation and behavior, including intensity, frequency, and changes over time, and provides the practitioner with more detail on the severity of suicide risk by identifying the presence of thoughts, plan, intent, and behavior. Various versions are available that assess for lifetime and recent behavior, as well as initial visit versus since last visit. It's also available from the Columbia Lighthouse Project in over 100 languages. The CSRS can be used in a wide range of settings by practitioners, paraprofessionals, family members and friends, first responders, school professionals, and others. It can be used in any type of setting, though more population-based settings such as primary care may opt to use a brief depression screening tool that includes assessing risk of suicide. For example, a positive response to question 3 on the PHQ-3A or question 9 on the PHQ-9A would warrant the administration of the CSRS. So some of these are screening and some are more of an assessment tool. We recommend starting with the screening tools first and then moving to an assessment tool with a positive screen. Crisis and helpline resources provide 24/7 free and confidential support, and there are a number of these available, and I would keep these numbers closely available. The result of a screen enables a provider to determine if a brief intervention or referral to treatment is necessary next step for the person. So the screening provides the clinician with valid patient-reported information, and often the process of screening sets in motion patient reflection on their own substance use behavior. And so this is cannot be underestimated as far as its impact. Screening, asking questions alone can be a beneficial intervention. So next you'll complete the section. Now that you'll complete the section on screening, take a brief quiz, review the tools, look at the materials in the section, and move on to the next section on motivational interviewing basics.